developing the commercial space travel sector. And so we decided that we wanted to do something similar in San Diego to stimulate new and interest in new approaches to improving health and healthcare access for the underserved. This slide provides an overview of Alliance Healthcare Foundation's strategic priority, and this slide guides all of the grant making we do at Alliance Healthcare Foundation. So this is not just specific to the I-2, but the I-2 certainly is one that we're considering as part of this. And what you'll see here is that the three sides of the triangle, we have the issues that we choose to focus on. And what we're interested in at Alliance is access to health for the underserved. We are interested in health as a characteristic of our population, but we recognize that the provision of health care itself is not always directly linked to health. It's not the only factor in linking to health, but since we are Alliance Healthcare Foundation, we often look at the healthcare delivery system as a way of enabling access to health. So we're interested in access to health and access to health care. We look at the issues of prevention, primary care, specialty care, mental health, and substance abuse. When you talk about prevention, we're interested in more likely tertiary and secondary prevention efforts, not the primary prevention efforts, which would be like health fairs and health education for the general population. We're more interested in the secondary and tertiary. The populations that we're looking for, people under 250% of the federal poverty level, and that's information you can get if you're interested to know exactly what income level that would be. That's not a hard, fast line for us. That's more an indication of the level of income that we're interested in the people that we're interested in having our dollars serve. When we talk about collaboration across organizations, we're looking for new types of collaborations. Personally, I feel like San Diego is a very collaborative community, a very collaborative town, and so we want to recognize that, but we also want to challenge our grantees to take it even further, and so we're interested in seeing collaborations that we haven't seen before. And you'll see that as we talk more about the I-2. Using technology, we're interested in using technology as a strategic lever to kind of advance the industry, not just kind of an operational tool. And then, of course, integrating care. So what do we think of when we talk about innovation? And this is obviously a very high level for us. But what we think about at Alliance, and this has been a journey that we've taken and a very interesting one. I think one of the biggest factors for innovation is that it's going to be something that's likely very disruptive. And so we're looking for ideas that aren't necessarily what we would traditionally have funded through our traditional grant-making cycles. So for instance, there are many things in the provision of healthcare services that are very necessary and aren't yet fully implemented. I would say case management is a great example of that. I know it would serve the populations we care about greatly if there were more widely available case management. I don't think for the innovation initiative if that's the primary idea, I don't think that's going to be the one that gets the prize in the end. So case management itself, primary prevention, an existing idea, taking it to scale, not necessarily what we're looking for in this particular grant-making cycle. We do have resources available for you on our website about what we consider to be innovation. We've written a white paper on innovation in healthcare that I would encourage you to take a look at and read, and that gives you some more insight into what we consider innovation. Many people are focused on innovation these days, many foundations and many healthcare entities, so we recognize that we are not alone in this effort, and we're very interested in building on what other folks have done in this area. In terms of what we consider to be healthcare access, this is a very general definition that you can find in many different places, but just kind of give you a sense of what we're talking about. Another resource that we have is a report that's posted on our website that we commissioned by an organization called FSG. It draws on data from the San Diego region and talks about what kind of the healthcare access issues are, and I'd encourage you to use that. There's also lots of other information about healthcare access for the greater San Diego region, and we can direct you to other resources beyond what we've got on our website if you're looking for more. I'm going to stop here and take a few questions because it looks like they've come in. And the first question that I see is, will we have access to the PowerPoint after the presentation? And the answer is yes. In fact, what we're doing right now is recording our broadcast, and so we will have a file that's available on the Alliance Healthcare Foundation website following this, where you could actually watch a rebroadcast of it. But we'll hang the PowerPoint slides separately. So now I'm going to, just to give you a sense of where we are in agenda, now we're at the section where we're going to talk about grant guidelines. And this is where I'm going to turn it over to my colleague, Jennifer James, who's Vice President at Harder & Company Community Research.
Well, good afternoon. We wanted to take a couple of moments to overview the grant guidelines. First, your application and ideas should improve health and healthcare access to Alliance's target populations, those that Carmen mentioned earlier, the children, homeless, the poor, and the working poor. We also are looking for that it be implemented fully and evaluated within 3 years, that it be an authentic partnership of agencies. An authentic partnership, and there's a definition over here to your left, where power, decision-making, and budget control is shared. And also to deliver a system-level solution to a healthcare access issue. Additionally, it must be innovative, not surprisingly. The primary applicant must be a not-for-profit organization. The project must benefit the populations of San Diego and Imperial County. Again, those are the target regions of Alliance. And the partnership in the project must have a San Diego organization as a partner. That organization can be a nonprofit, a for-profit, or a public organization. There's a priority for ideas that are going to impact large numbers of those target populations we just talked about, or really going really deep with a specific population. And also, we mentioned, Carmen mentioned earlier, the innovative technology is that Alliance anticipates that technology will be part of your solution, but it is not necessary to actually apply for this grant opportunity. For leveraging, Alliance encourages applicants to secure other financial and in-kind resources for the project, and they want these projects to be sustainable, to generate dollars other than grant funds within 3 to 5 years of the grant. Note that Alliance will not fund partnerships without a San Diego partner. It will not fund projects without realistic plans of implementation or sustainability. Those are key factors. And of course, once again, projects that are not innovative. It doesn't look like there are any questions right now, so we are going to move on. Oh, wait, one just came through. The question is, the area served must be both San Diego and Imperial County? And no, the answer is it does not have to be both.
In fact, what we're looking for, you don't have to serve the entire region in order to be a viable applicant for this. The criteria that we'll use have to do with really, it's almost like are you going broadly in your scope, or are you going deeply in your impact? And I mean, ideally you could do both, but what we're looking for is something that will have a profound effect. But that doesn't mean you have to cover all the underserved in all of San Diego County or all of Imperial County. You can be serving a region of the county, so long as what you're doing is either serving a large number of people, or for the smaller number of people that you're serving, that it's a pretty profound. And so that's how we'll be looking at that.
We have another question that just came in that asks, will a school district be able to apply? And the answer is yes.
Absolutely. We would welcome an application from a school district. That'd be a terrific partnership, among different agencies, and the school district would certainly be one of the partners that applies. And we would accept the school district being the primary applicant, because we can do that, even though they are not a 501c3. Thank you for that question. That's a good clarification. There's another question that I see here that is, can you serve other communities if you bring in leverage dollars? And so